Hello, this is Mike Kelly, nurse practitioner, and this is my personal plan for innovation and leadership as I progress through the DNP program. First, I'd like to discuss my strengths. They include emotional intelligence and communication. Emotional social intelligence is the psychological and social traits of an individual in addition to his or her ability to use common sense to function in society. Emotional intelligence includes interrelated emotional and social capabilities that include self-perception, self-expression, interpersonal skills, decision-making, and stress management. A provider who lacks emotional intelligence lacks the ability to effectively communicate with their staff. This can create poor organizational climate at work and contribute to an overall increase in medical errors. Communication. Effective communication and interpersonal skills surface as the essential professional skills that providers should master. Next are my weaknesses, which include conflict and collaboration. Conflict can be generally described as an interactive process manifested as incompatibility or disagreements between two or more people that appear to be incompatible. Moreover, if conflict is not dealt with properly, it may significantly affect employee morale, increase turnover, and overall well-being of the organization. I tend to avoid conflict as a provider. This is done easily given that the majority of work I perform is one-on-one with patients. Collaboration, according to the Canadian Interprofessional Health Collaborative, collaboration is a core domain for effective leadership. Collaborative teams that engage employees more frequently in problem identification and resolution have a greater impact on productivity and quality improvement. Further, collaboration allows a greater range of experience to meet fresh ideas. Moreover, evidence shows that collaboration positively correlates with the improved organizational performance. I tend to isolate and avoid collaboration by working in a solitary environment and performing my own research. DNP leader. Guiding the DNP leader is a personal philosophy and developmental opportunities. Personally, knowledge is the core of success. Knowledge represents learning, implementation, redefining, contributing to evidence-based and contributing to evidence-based knowledge. In addition, core values extend to the level of advocacy. According to Antel 2015, advocacy is defined as influencing those who have power on behalf of those who do not. Advocacy is solidified early, benefits patients, provides directions, and builds trust. As personal values unfold, utilizing a theoretical model congruent with these beliefs facilitates a personal philosophy. Nursing philosophy utilizes Martha Rogers' theory of science of unitary human beings is utilized. Theory's assumptions understand the wholeness of a human being. Understanding that man is characterized by the capacity for abstraction, language, thought, and emotion makes the theory useful for psychiatric patients and the project intervention of non-adherence. Developmental opportunities. Developmental opportunities to improve strengths include emotional intelligence and communication. The emotional intelligence of a provider shapes their interaction with staff and patients. However, the emotional intelligence of the provider and its impacts on quality of care seems to receive less attention. According to Aurora et al. 2010, emotional intelligence had an impact on patient care competencies and empathetic patient-centered care. The emotional intelligence exuded by a leader affects organizational climate and overall job satisfaction. A study found reflective awareness of feedback among the group allowed emotional intelligence to prosper significantly. As an organization, we meet weekly to discuss organizational growth and patient care. This provides an excellent opportunity to promote and improve the emotional intelligence. Communication. Suboptimal communication is the primary cause of medical mistakes and is linked to more than 98,000 deaths per year. Further, the strategy utilized for change is primarily communication. In addition, communication among employees develops an awareness of changes, as well as reducing feelings of uncertainty. To improve strengths and increase collaboration will take place weekly during our clinical case discussion, which is every Tuesday at 8 o'clock. My scholarly project, the clinical problem is psychotropic non-adherence. Non-adherence refers to any form of failure to take medication as prescribed. This includes premature termination or dosage alteration. Psychotropic use has a 52% non-adherence rate. In addition, non-adherence increases the return of symptoms, rehospitalization, and increased economic costs. The plan is to implement an intervention that entails consistent pharmacoeducation with a handout. Advancing the DNP role. Advancing emotional intelligence development. Communication is paramount and is affected with unhealthy emotional intelligence. The Medical Appraiser Development Center utilizes an appraisal process in which providers are able to reflect on their work and identify their strengths and possible weaknesses. Further, these appraisals enhance confidence and increase awareness of self and others. Once a week in our meeting, we can institute this reflective process at the project site, and this will enhance awareness of my own emotional intelligence. Also, to advance emotional intelligence for the DNP role, the EQ-I 2.0 is a systematic form that can be utilized to measure emotional intelligence. This form scores for self-expression, decision-making, and interpersonal skills. Advancing communication could take place exchanging change-related information, and that is paramount for keeping employees aware of organizational and job changes. Further, poor communication surrounding the change may result in widespread cynicism and resistance to change. Moreover, authors have shown that providing information can help significantly reduce organizational uncertainty and anxiety. The model to improve communication for advancing DNP role includes the exchange, communication, expectation, and commitment model to improve a facilitated change. This model will advance communication by encouraging and facilitating team exchange. Developing innovation. Innovation. Personally, I identified 4 characteristics of transformative leadership congruent with the project views. Unique, innovative characteristics that inform transformation or transformative leadership include technical expertise, ambition, integrity, and empathy. According to Dong et al. 2012, technical expertise implies competency in one specialty. In addition, ambition is described as the willingness to adopt change and the energy to pursue it. Further, integrity combines honesty, honor, and trustworthiness. Last, empathy is described as a genuine concern for others with respect towards subordinates. Nursing scholarship is a product of innovative processes. For project development, strengthening adherence by forwarding innovative change will be made possible by utilizing evidence-based info to promote adherence. Developing scholarship. A personal selection of scholarship qualities includes scholarship application that improves practice by implementing new practice and allowing feedback. Integration is instituting the new knowledge of clinical practice while teaching. This engages providers with new evidence-based knowledge. For project development, I will apply scholarship by implementing an intervention from new knowledge and then integrating it through pharmacoeducation. Last is developing leadership, communication, change, emotional intelligence, and advocacy. Leadership qualities include communication. That is, communication is a leadership skill that transmits a verbal and nonverbal message. Change is the ability to extract evidence-based data and formulate a new plan for patient and or staff betterment. Emotional intelligence, managing one's own thoughts, regulates actions and provides role model presentation. And advocacy is utilizing resources, recognizing gaps, and instituting actions, and a voice for the patient. Project development. I will implement a strengthened emotional intelligence to avoid countertransference with patients and organizational barriers that may arise at the project site. In conclusion, this has been a visual presentation of my innovative and transformational role as a DNP leader. Thank you.